Chris, Boston, the great WRKO country. How are you, sir?
Not too bad. And how are you, Mark?
Very well, thank you.
Well, it's a pleasure to talk to you again. I called you, I believe, a couple weeks ago now. I'm Dr. Chris from Boston about the Affordable Care Act.
Oh, yes, doctor. Welcome.
Yes, thank you. And just calling back in, I see the work going on with the immigration bill and everything else, and everybody's kind of missing again what's going on with the Affordable Care Act. And I think patients in general, everybody's so kind of clouded by the agenda of Obama and his administration. They're not actually paying attention to what it's now subsequently doing as we head into 2014 when this bill is supposed to really take effect and some of the really hard-hitting provisions.
Okay, what's it doing?
Well, at this point, it's very easy to see that, rates have actually already gone up on a large number of people. Approvals for, temporary insurance for those who are uninsured in Massachusetts. So we have several patients right now on the floors that cannot get Mass Health and cannot get insurance to be transferred out of places like the ICU, which is incredibly expensive. And so here we have all these provisions in place to provide people with
insurance. All right, let me slow you down. We're going too fast here. So in Massachusetts, people are being transferred out of the ICU because they lack insurance now. Is that what you just said?
No, they're actually stuck. So one of the things that a large number of our patients come in that don't have insurance but end up getting some form of a catastrophic illness or major procedures and get stuck in either the ICU or out on one of the non-critical care floors. And when their care is essentially done or we can't do more for them at the hospital, they need to go to a rehab or a step-down type of facility. They still need to have certain types of insurance to transfer out. And we're finding actually a large number of
I'm hearing the opposite. I'm hearing that people are being pushed out of the ICUs prematurely.
Well, we certainly do see some of that. For example, we've had lots of policy in place where we, for example, when you get some sort of an intravenous line or something called the central line, and we're worried that it's infected, lines get infected, one of the practices would be to pull the line out and send it for culture. And there's a lot of different techniques with that we do to diagnose a source of a fever or something else. We don't actually send the catheter now because if we find out the catheter...
No. Okay. What I'm saying, doctor, is I'm hearing that more and more people are being pushed out of the ICU, the intensive care units, earlier as a result of Obamacare.
Absolutely. And, with cost-cutting measures, and I think the big burden that we're facing as for all hospitals nationwide is the information technology requirements of the Affordable Care Act, namely the requirements for, electronic medical records, the ability to connect.
And where does all that information go after you enter it in the computer?
Well, this is what we were talking about the last time I called.
I know. I'm trying to get you to reinforce the point.
Sure,
so where does
absolutely.
all that information go?
So it flows directly into the health exchange, which then flows directly to the IRS. So essentially, side by side is your financial information with your healthcare information. And we were reviewing some policies the other day, for example, for HIV testing, which some patients really hold very confidential. You think it's your records and you want to say, well, I don't want that information transmitted to this other provider, to this institution. And some of the clauses in the Affordable Care Act actually say, well, you just have to tell the patient or offer them the choice, but you don't have to grant them their wish. The information still will flow out to the exchange and then out to the IRS. And so just like with the metadata, when you can track people, you can track their prescriptions and see that they have HIV prescriptions.
Anyway, it's very, very invidious what's going on here. The most hated agency in the federal government, next to the EPA, or maybe a little bit more than the EPA, is the IRS. And, of course, they turn over this this healthcare enforcement, healthcare collecting of data to the IRS. I mean, it's just. I mean, it's right out of the old Soviet handbook. It's just disgusting, and people just happily go along. Oh, I'm going to get free healthcare. Oh, as a matter of fact, what did Pelosi say today? Thanks for your call, doctor. Call again. God bless you. Didn't Pelosi say something stupid today again, Mr. Producer?